Good afternoon. I'm Keisha Bohannon, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, welcome to the December 4, 2024 Zoonoses and One Health Updates call. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/1-health/php/trainings-events/December-2024-ZOHU-call.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1. Identify an implication for human, animal, and environmental health. 2. Identify a One Health approach strategy for prevention of public health threats. 3. Identify a One Health approach strategy for detection of public health threats. 4. Identify a One Health approach strategy for responding to public health threats. 5. List 2 ways to improve collaborative practice across the public healthcare team. Next slide. In compliance with continuing education requirements, all planners and presenters must disclose all financial relationships in any amount with ineligible companies over the previous 24 months, as well as any use of unabled products or products under investigational use. CDCR planners and presenters wish to disclose they have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Content will not include any discussion of unlabeled use of a product or product under investigational use. CDC did not accept commercial or in-kind support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/1-health/php/zohu-index.html. To receive free CE for today's webcast, sign in or create an account at train.org by January 6, 2025. The course access code is ZOHU Webcast. A captioned video of today's webinar will be posted on our December call page within 30 days. Free CE for the web on-demand video of today's webinar will be available until January 7th, 2027. Next slide, please. Before we begin today's presentations, CDC's One Health Office Deputy Director, Colin Basler, will share some news and updates.
Thanks, Keisha. Good afternoon, everyone, and thanks again for joining our December ZOHU call. Please remember to share the ZOHU call website link with your colleagues from public health, agriculture, wildlife, plant, environmental health, and other sectors so we can let them know about the live and recorded webinars and free continuing education that ZOHU calls offer. Before we start the presentations, we'd like to share some monthly updates and resources. You can find links to these resources in today's ZOHU Call email newsletter. If you aren't subscribed to the newsletter, you can sign up using the link on our main ZOHU Call webpage so that moving forward you can get these updates. CDC continues to work closely with federal and state partners to monitor the H5 bird flu activity in people, wild birds, poultry, dairy cows, and other mammals. You can find the latest updates on CDC, USDA, and FDA's websites, including situation updates, recommendations for protective actions for people, confirmed case counts in domestic livestock, and more. Next slide, please. In today's newsletter, we highlight several recent publications, including a publication that explores linkages between soil health and human health, and another that compares individual and community-level characteristics of people with ground beef-associated salmonellosis and other ground beef eaters. Next slide, please. Additional publications highlight Our additional publication highlights include emerging infectious disease publications, such as one publication titled Using SARS-CoV-2 Sequencing Data to Identify Reinfection Cases in the Global Emerging Infections Surveillance Program in the United States, and the molecular characterization of norovirus causing acute gastroenteritis outbreaks among U.S. military recruits 2013 to 2023. Next slide. The newsletter also highlights recent announcements and resources, including a Health Alert Network health advisory on the first case of Clade 1 monk mpox diagnosed in the United States, and a webpage on how food gets contaminated, the food production chain. Next slide. December observances that may be of interest include National Influenza Vaccination Week, which is happening this week, December 2nd through December 6th. World Wildlife Conservation Day is today, December 4th. World Soil Day is tomorrow, December 5th, and the International Day of Veterinary Medicine is December 9th. Next slide, please. Finally, we've shared several new and ongoing outbreak investigation updates, including a new listeria outbreak linked to ready-to-eat meat and poultry products, and a new E. coli outbreak linked to organic carrots. Next slide. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases and links from today's newsletter. You can find details about additional ongoing U.S. outbreaks. Our next ZOHU call will take place on February 5th, 2025. Please continue to send presenter and topic suggestions for future presentations, as well as news from your organization to zohucall@cdc.gov. Next slide, and over to you, Keisha.
Thanks for those updates, Colin. All right, so you may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenters' names, and the Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on this slide and in today's email newsletter. So now we can begin our presentations. Next slide, please. Dr. Jason Lombard will share the first presentation titled An Overview of Highly Pathogenic Avian Influenza, HPAI, in Dairy Cattle. Please begin when you're ready.
Thank you for that introduction. The first thing I wanted to just say is there was an excellent ZOHU call back on October 2nd, and so if any of the participants haven't heard those presentations by Dr. Diebel, Durand, and Bernsteel, that would be worth time well spent to go back and listen to that ZOHU call. Next slide. So just a disclaimer, the findings and conclusions in this presentation are my own and should not be construed to represent any official USDA or US government determination or policy. I was with USDA for 20 years and a little over a year ago moved to Colorado State University. But the data used in part of this presentation was made possible in part by an agreement with USDA, and this presentation may not necessarily express the views of APHIS. Next slide. So some significant disease dates. February 8, 2022 was the first time that USDA confirmed high-path AI H5N1 in a commercial turkey flock in Indiana. That is the initial start of the current outbreak that's still ongoing. In early 2024, there were uncharacterized cattle morbidity event occurring in the southwest part of the United States with reports of large bird die-offs potentially associated with some of these cattle operations. On March 25th, USDA confirmed high-path AI H5N1 in dairy cattle. And I've got an update. Unfortunately, the number of herds continues to increase. As of today, we're at 707 dairy herds in 15 states that are affected. Next slide. This is a map showing the poultry affections that have happened, detection since February 8th. There have been over 110 million birds affected, over 1,200 flocks in 49 states. Somehow Louisiana has stayed clear of high-path AI, with a slight increase, higher percentage in backyard flocks. And the best estimate is about 1.3 billion that has been spent on the poultry outbreak to date. Next slide. This slide shows the detections of high-path AI in mammals. from May 2022 to the present. And you can see that there's a lot of cats, mountain lions, bears, coyotes, skunks, mice as well. I've got there internationally, there were 5,000 sea lions that perished in Peru. More recent publication shows that there were over 24,000 sea lions that have perished in the area of South America. You might have heard about a recent detection in swine in Oregon, and that is different from the dairy cattle B3.13 that we'll be talking about mainly today. That was the D1.2 genotype. So it's still a little alarming that we're seeing that in essentially a backyard swine operation, but it is not related to the dairy cattle strain that we're going to be talking about today. Next slide. Okay, so this is a summary that USDA has. I updated this a few days ago when I submitted my slides. Like I mentioned, now we're up to 707 herds in the 15 states. We really know that that is an underestimate of the number of herds that are affected. We don't have a good estimate on the number of cattle that have been affected with this disease. And USDA has received over $800 million in funding to address the disease challenges. Next slide. So at least from our perspective, some of the current challenges is how is the virus moving from herd to herd? And I think that's still the biggest question we have. We know that herds have been affected through the introduction of cattle, but we also know that somewhere close to half of the dairy herds that have been detected did not move animals in the 30 days prior to infection being detected. And so trying to figure out how this virus is moving, I think, is really critical to trying to stop it. How the virus is moving cow to cow is something that we'll talk a little bit more about today, but that first one is still the most critical question to answer. Are younger cattle and non-lactating cows involved in disease spread? I think that's important because the federal order that's in place really restricts the movement of lactating dairy cattle. And if we're moving other cattle that are moving this disease around, that's important. Is reinfection or relapse already occurring on some farms? And we're working with some farms here in Colorado that have been seeing clinical cases for 4 months now. And it seems like they're starting to decline. We don't really have the data back yet to say, is this reinfection or relapse? Some of these farms do have offsite rearing facilities where they move animals offsite when they're non-lactating or young animals, and then move them back as lactating animals. And so some of those might have not have been exposed during the initial outbreak, and now they're coming up with clinical signs and disease. Next slide. So I just want to talk briefly about 2 studies that we're working on. One is the early detection of herds. We're working with actually a private veterinary clinic in California that enrolled quite a few herds, and they're taking daily bulk tank milk samples, so aggregate milk from the entire herd, taking those on a daily basis and screening those. And then herds where we find PCR evidence of virus in the bulk tank milk, then we're going out and doing individual pen milk samples to determine, okay, we know it's on the farm, which pens are the virus in, and what can that give us clues about how the virus is moving around the farm. The next study is a longitudinal study where we're enrolling 20 cows that are clinically affected and 10 unaffected cattle and sampling them serially over about a 10-week period to determine where they're shedding and how long. The other one in there is looking at antibody production in both serum and milk of those enrolled cows to see what kind of immune response is taking place. All right, next slide. Okay, so this is a graph of PCR values for this farm. So we consider 40 to be non-detected. And so this farm had been sampled since early October, and on 10/24 they had their first bulk tank detection. And you can see how that CT value has decreased, meaning the viral load in the milk has gone up. And then by the time we get out to toward the end of November, that curve is starting to go back up. So we're seeing less virus in the bulk tank. Next slide. So on 10/24 was the first detection in the bulk tank. 10/28 was the first time that they'd noticed nasal discharge, as seen here in the picture on the right. Somewhere around 20 to 30% of the cows in the herd had some form of nasal discharge. Most of it was more serous and clear. This was a little bit more severe case of nasal discharge. Next slide. On 11/1, they started to see other clinical signs. So mastitis is one of the most common ones, cows with fevers. That's when that really started. There was a note that they had started to have loose manure on the 4th of November. So about 10 to 14 days after the first detection in the bulk tank. Next slide. So this gets a little bit messy, but what we've done here is just place the pen samples. And this farm had 11 different pens, and you can see by the legend on the right what animals were in those pens that were sampled. And so when they first started taking the pen samples on 10/31, it was already present in 5 of the 11 pens that were sampled, and then all 11 pens by 11/4 were PCR positive and really mimicked what we saw going on in the bulk tank as we continued to take that bulk tank. So this farm was moving clinical cows that they detected out of pens into a hospital pen, but you can see we have a lot of cows that appear to be shedding the virus that aren't necessarily clinical and detected by the dairy. Next slide. So just on that early detection, that was the one herd that we had break that we were able to follow. Over the weekend, they had about 10 herds that broke that we'd been following. They'd been monitoring 20 herds total. And so we're going to have a lot more of that type of data coming in the next few weeks. The other study that we're working on is the longitudinal study. And so there's a lot of information on this table. What I really want to focus on is what's in the yellow, and that's the enrollment of clinical cows and non-clinical cows, and sampling those once weekly for nasal swabs, blood, and urine, and then twice weekly for milk. And we follow those cows for up to 10 weeks. And what we're really trying to do is we're trying to follow them until we have 2 successive sampling periods where we don't have any shedding for some of these cows, if they are shedding. Next slide. So HPAI clinical signs are really, obviously they're not pathognomonic for HPAI, but we do tend to see some consistent clinical signs that we're seeing in herds that we've been working with. And on the slide on the left, the picture on the left, that almost looks like saliva hanging from all those cows, but this is in a parlor, and almost all those cows had that clear serous nasal discharge. And this was 1 to 2 months after the disease had gone through the herd. So we don't detect virus in that on those nasal swabs, but that sure seems to be associated with the presence of the disease on the farm. The 2 middle cows were a little bit more severe in terms of their nasal discharge. And then the slide on the pictures on the right are some individual quarter samples from affected cows. And you can see on that top one, she actually had some bloody milk in the right front, and then the left hind had pretty nasty mastitis, and then the left front on the bottom cow had mastitis as well. Next slide. All right, so this was a farm that we sampled. This is primarily looking at the shedding in milk over time by PCR detection. So on this farm, we enrolled 21 clinical cows, 10 non-clinical cows. And at some point during our sampling period, 17 of those 21, or 81% of the clinical cows were shedding, and 20% of the non-clinical cows were shedding. And that's typically what we've seen across the herds that we've been sampling. It varies a little bit, but the majority of the clinical cows, we do find virus, and the majority of the non-clinical cows, we don't find virus. So as we look down, the red here represents PCR detection in milk. The gray is PCR negative, and then the white is not tested. And the very top row is the bulk tank milk, which I think is somewhat interesting. It was tested and positive in terms of virus detection on 8/9, and then was remained negative for the rest of the sampling period, yet we had cows such as 19821, that first cow that was positive in terms of milk shedding for 75 days. That next line for 19821 that's got the asterisks is actually a urine positive sample that we detected. This was the only urine positive cow we found in this herd, and that was at the very first sampling of that cow. What I take away from these when I look at these is we see a period of shedding, and then we find PCR negative, and then generally we find additional shedding. And I don't know if that's a function of the sample that we've collected not being able to find the needle in the haystack of milk that we're collecting, or if they're truly not shedding the virus during those periods of time. When we see something like this on that 8/23 sampling date, we will ask the lab to go back and retest some of those that showed up positive again the next sampling period, just to see if there was a problem with the testing. The non-clinical cows down at the bottom, that first cow is unusual for us to see that in a non-clinical cow where we have multiple sampling periods that are positive. That last cow, 19118, where we see one sampling period that's PCR positive, is generally what we see on non-clinical cows, although we know that clinical signs are not always consistent, and depending on what the farm's using to detect cows, those could vary between farms. Next slide. So here's another farm that we're working with. This is a little bit different farm. This is one of our chronic farms. So by the time we got out there, they had been dealing with this disease for 2.5 months. And so we didn't find, of the 8 cows that they enrolled, we only found 3 of them that were shedding. So the 4949 is one of those where it's on again, off again in terms of shedding. And we've got one more sample from her coming from 1122 that we don't have results back yet to determine if we can stop sampling that cow. Next slide. This is a little bit of an interesting cow that she presented to us on 9/20 as a sick flu-like cow, and we tested her, but we didn't get a positive PCR detection until 10/4, so 2 weeks later. And we started taking a lot more pictures, especially with all the nasal discharge that we saw. So on 9/24, she had pretty significant nasal discharge, but was PCR negative in milk and nasal swab. But on 10/4, she was positive on nasal swab, and then a long string of milk samplings after that. And you can see on 10/18, when we took her picture there, now she went from that kind of serous to a little bit more of a bloody nasal discharge. And some of the herds that we've worked with, we've seen quite a few cows that have had that bloody nasal discharge. And of course, cows are fairly prone to respiratory disease, and we do see that, but not at the level that we're seeing it in these herds that have had high path AI. Next slide. With that, I'd like to acknowledge all of my team members that have been out. We've been sampling. We've done over 100 herd sample days, and now we're working with a lot of folks in California trying to get on farms early and learn more to try to figure out how this disease is spreading, so that we can try to give producers more options for biosecurity mitigations. And with that, I'd happy to take any questions. Thank you.
Thank you, Dr. Lombard. Thanks so much for sharing this presentation. We will go, thank you. Going to the next slide. Our final presentation will be given by Drs. Angela Werner, Dr. Stephanie Schollert-Ooze, and Dr. Helen Amos. The presentation is titled Public Health Data Applications Using the CDC Tracking Network, Augmenting Environmental Hazard Information with Lower Latency NASA Data. Please begin when you're ready.
Great. First, I wanted to thank you for inviting us to speak today. We're looking forward to sharing information about our collaboration and also hearing from all of you on environmental hazard data that you'd like to use in your own work. Next. Next, please. I'm going to start with a bit of information about CDC's tracking program for those who aren't familiar. Our mission is to provide information from a nationwide network of integrated health and environmental data that drives actions to improve community health. Our goal is to empower environmental and public health practitioners, healthcare providers, community members, policymakers, and others to make information-driven decisions that affect their health. As a program, we're focused on promoting the use of data to inform action, strengthening partnerships, advancing data modernization, and accelerating workforce development. We're also focused on disseminating timelier, finer spatial resolution data. Next, please. CDC funds 33 recipients through a cooperative agreement. Through this cooperative agreement, we provide funding for recipients to build, maintain, and implement local tracking programs and data networks, grow public health capacity and expertise in environmental health surveillance, modernize data systems by focusing on interoperability and real-time data, and finally, to modernize the collection, integration, dissemination, and application of timely local environmental health data. We work with recipients to identify and fill data gaps, create nationally consistent data and measures for dissemination via the tracking network, and use the data for public health action, just to name a few activities. Next, please. We need data to make information-driven decisions. At Tracking, our aim is to connect environmental information and health information together, all in one place. We make these data accessible to anyone and make it easy to share. This slide just shows a list of some of the topics that tracking covers, from environmental hazards and characteristics to exposures and health effects. This includes the various data sets that we've been working on with NASA so that we can make these data more accessible to public health practitioners. Next. We deliver these data in a variety of ways to serve the different needs of users and inform decision-making at local, state, and national levels. As mentioned on the previous slide, we have data sets covering many topics, including data from NASA, so it's likely we have something that is of interest to you for your work. Next, please. Our flagship product is Tracking's Interactive Data Explorer. It has over 700 environmental and health data measures. It has a variety of data visualizations, so you can create choropleth maps and look at the data side by side with other maps, or you can transform that data into charts and tables. You can download the data for further analysis or export the maps. We also have a feature that allows you to embed any map, table, or chart you create into your own website or app using a few lines of simple code. Next, please. We've also created different dashboards which focus on a particular topic area, such as unusual patterns of cancer, heat and health, or environmental justice. These interactive dashboards are tailored to your specific community and provide additional context to the data, such as text or infographics, to help with data literacy and overall better understanding of the data. Next. All of our data can be accessed by an API, so it can be used by developers when creating their own apps or websites. We use our own API to feed data from the Data Explorer into our dashboard, so they're always up to date with the latest data. Next, please. We can't do all of this by ourselves. We work with many experts and partners, including federal partners like NASA, EPA, and NOAA, state and local health departments, national organizations, and other key groups to build our data library and collaborate on projects. Our network of partners has vast expertise in environmental health, public health, data science, earth sciences, remote sensing, and other fields, allowing us to build tools that can help solve environmental and health issues across the United States. This presentation highlights some of our collaborative work with NASA Goddard, and I'm pleased to turn it over to Stephanie to share more about NASA and our collaboration.
Thanks. Next slide, please. So for those who aren't familiar with NASA, I'll provide background on our mission with a focus on earth science and applications, and then provide some context and motivation for the NASA Goddard partnership with CDC Environmental Public Health Tracking Network. Next, please. So NASA's mission in one word is to explore. Most people are familiar with our space program, but might not know that we also have a science mission, including Earth science, where we seek to understand what makes Earth habitable and how is it changing. The NASA workforce is spread across a lot of centers. You can see here the largest ones on this map across the United States. NASA Goddard is located in Greenbelt, Maryland, and it hosts the largest Earth Science Division with over 1,400 scientists, research scientists, co-located with the engineers who design and build our Earth observing instruments and platforms, our satellites. Next, please. So this is a map showing our current Earth observing fleet, our satellites, and Goddard provides about half of these satellite missions are designed and built at Goddard. It provides a really unique opportunity for Earth scientists to work together with the engineers to ensure that our satellite missions are designed to address fundamental science and applications needs. So in the center of this, toward the Earth there, are the blue colored satellites that are in extended operation. Some have been up for decades. The Terra satellite there is getting ready to celebrate its 25th anniversary this month. And then in green, those missions are operational. Orange ones are just getting ready to launch. And then the purple are still in formulation. It takes about 10 years from when a satellite is authorized by Congress to when it's built and launched. So these all monitor Earth's vital signs, from clouds and gases in the atmosphere to Earth's surface, both land and water, as well as its subsurface, including groundwater storage changes. Next, please. At NASA Goddard, my group focuses on connecting all of the great basic and applied research happening here to societal challenges to improve life on Earth. And one of the ways we do this is through thematic working groups focused on food security, disasters, climate and health, air quality. Plus, we have a group with a regional focus on the Chesapeake Bay watershed, so we can meet with local practitioners, as well as a mission applications group to prepare the communities of potential as early adopters for our future satellite missions, so that we maximize each satellite's practical use along with its new science. Next. So NASA Goddard has a long history of supporting food security applications in partnership with USDA and others and universities. And we leverage NASA observations of vegetation health, water availability, water quality, and air quality to improve prediction of and agricultural outcomes. So we prepared these fact sheets that provide an overview of our relevant variables that we use to monitor these things. And they're available at that website. And we also have hard copies that we bring to meetings. Next, please. So one example product is our Crop Chasma soil moisture analytics product, developed by scientists with USDA, as well as George Mason University and the NASA Goddard Hydrology Lab. And so Crop Chasma integrates measurements from our soil moisture active passive, or SMAP satellite, as well as vegetation indices from the moderate resolution imaging spectroradiometer, or MODIS instrument, on our Terra and Aqua satellites. So these near real-time maps provide early warning of areas that are experiencing either drought or soil saturation. In this map, the soil moisture anomalies in red are more drought prone, and then in blue, those are saturated at the time that this map was collected. And these are updated near real time, and they bring the soil moisture measurements down to 1 kilometer spatial resolution. Next, please. We also NASA Goddard pioneered the detection of plant primary production from space through the photosynthetic pigments, and as well as phytoplankton at the base of the marine food web through ocean color remote sensing. And over the past few decades, this has enabled new discoveries about the ocean biome and its role in regulating our climate. And again, partnerships are critical to increasing the practical uses of our data. We partner with NOAA for fisheries and coastal water quality, and then with EPA and USGS for inland waters. So examples shown here of applying our data for practical uses are the offshore fishing industry, inland recreation, and coastal aquaculture and mariculture. All use our satellite data to help make their decisions. Next, please. So our nighttime lights, which is also called black marble, it's used to detect economic activity. And in this example, it's detecting power outages. So for example, the lights over Eastern Turkey before the earthquake in February 2023, you can see the lights on the left, and then after the earthquake in the example on the right. These maps are shared with humanitarian organizations such as Red Cross and Red Crescent to support their disaster response. Next, please. So in partnership with the U.S. Forest Service, we provide near real-time fire mapping and air quality monitoring and forecasting. And this example is from last summer, showing fires around much of North America with large fires burning across Canada. And there's also a global product of this. And again, the website is on the bottom. Next, please. So all of our data are public and freely available. NASA Worldview hosts near real-time and historical Earth observations, including the examples that I just shared, plus clouds, precipitation, flood. We have a lot of data, vegetation on land and water, and more. And you can go and grab it. Next, please. And in addition to all of our observations, we also have modeling groups that assimilate the data into historical reanalyses, as well as forecasts that range from days to seasons, and then long-term climate projections. So the example on the left is from a press release this summer in July. Data from our reanalysis and forecast models showed we were reaching the hottest day, globally average day ever on record. And so all of the data in the white part of the time series those were from 1980 to 2022. And then the pink is from 2023. And then the red is June, or all the way from January to June of 2024. And then the purple was a forecast showing that July 2020 or July 22nd was at that point predicted to be, and it was later confirmed to be, the hottest day ever recorded on Earth. And these results agreed with an independent analysis done by the Europeans. And then the map on the right shows global temperature anomalies during September of 2023, which were warmer than average over most of the world. All of the yellow to red temperatures there show warmer than average temperatures. Some of the reasons were understandable, like the El Nino that we had in the tropical Pacific, but a lot of the reason for these higher than normal temperatures they lack attribution. So the story that goes along with this map, it describes that global temperatures broke records for 15 straight months between June of 2023 until August of 2024, according to scientists from our Goddard Institute for Space Studies up in New York. And this level of warming is surprising even scientists. Next, please. So again, partnerships are critical to getting our data to new audiences. And so we are motivated to partner with CDC. We've got this agreement now to get our data into their tracking network to be co-located with the health data. And Helen is going to describe some initial examples and results.
Excellent. Thanks, Stephanie. Next slide. Great. So a summary of our initial progress that we've made together was published last year in the journal GeoHealth, and I'm going to present some of the highlights. So CDC tracking aims to bring its user community data that can support information-driven decisions. And sometimes that information can be fragmented, hard to find, or if you find it, it's in an unfamiliar format that's hard to work with. So this work we've done together brings timely, routinely updated NASA data into CDC Tracking Network's Data Explorer in familiar and accessible formats. NASA datasets integrated into the Data Explorer include daily flood maps, daily 5-day air quality forecast, and historical daily air quality data for all of the contiguous US for right now. So now I'm going to give you a sense of what some of these datasets look like. Next slide. So what you're looking at is an image from space of Hurricane Ian in 2022 as it approaches Florida. Next slide. And Hurricane Ian caused really extensive flooding across southern Florida. Shown here is the NASA MODIS Near Real-Time Global Daily Flood product that has been brought into Data Explorer. So on the left, you can think about this as baseline or before conditions, and on the right is after Hurricane Ian made landfall. MODIS can't see through clouds, so where clouds obstruct the view of the surface, that's all masked out gray. And red indicates floodwater, and you can really see a big difference in the spatial extent and just how widespread the flooding was from the hurricane across southern Florida. Next slide. In this image, you're looking at really heavy smoke from Canadian wildfires in the summer of 2023 that just blanketed the northeastern US and really poor air quality. So the smoke lasted for days and placed millions of people under air quality alerts in major metropolitan areas. You see New York City here too. I lived in Washington, D.C. when this was going on, and the skies were orange. It was wild. Next slide. So available in Data Explorer is a 5-day forecast now based on NASA's GEOS composition forecast, which can provide you with information about, for example, where is the pollution plume expected to move? And where is it expected to get worse over the next coming days, or where might it be expected to be improving? Next slide. So last example, this image displays different types of particles shown in different colors that can contribute to poor air quality. For example, there's a big blob of sort of yellowish gold dust coming off the Sahara over the ocean, that sort of sea foamy color, that sea salt coming off of Australia, and those fiery colors, that's black carbon from bushfires. So this is helping you sort of visualize what the MERA-2 product offers. And the MERA-2 product, which we brought into Tracking's Data Explorer, is a model measurement fusion that makes available a historical record, not just of total particulate concentrations in the atmosphere, but also broken down by type. So you can begin to investigate things like the association between asthma emergency department admissions and the composition of the air pollution being breathed. Next slide. So for more information, you can dive into our paper. Here's the citation again, or you can go to the Data Explorer and begin pulling up maps of these measures that are of interest to you and plotting them alongside social determinants of health or other health outcomes of interest. Back over to you, Angie.
Thanks, Helen. Next. Next, please. So we're excited to share more information about some of our future work. The first is our work with NASA on Black Marble. Black Marble is a calibrated, corrected, and validated product suite, so nighttime light data can be used for scientific observation. We hope to add annual, monthly, and daily artificial light at night measures at the census tract level. NASA is currently working on refining a machine learning model to allow for event-based power outage detection that would provide us with retrospective information on time to restoration. With this, we plan on creating measures for the Data Explorer that will serve as a proxy for power outage through change in radiance. We hope to add information about time to restoration, which will help inform response and recovery efforts. In the future, we hope to be able to compare these data to real-time county-level power outage data available from poweroutage.us. As I mentioned, these data will be at the census tract level, allowing for finer spatial resolution display of these data for public health application. Next, please. Through previous work with NASA Goddard, we worked on creating daily and forecast air quality measures for the Data Explorer. The forecast data are from the NASA GEOS Composition Forecast, or GEOS-CF product that Helen mentioned, and include a 5-day forecast for PM 2.5, SO2, NO2, CO, and ozone. This produces 5-day forecasts that are produced once per day and a 1-day hindcast that is provided for reference and validation purposes. The other measures are daily air quality measures that are from the MIRA 2 product. This also includes PM 2.5 and individual constituents like Helen mentioned, including dust, black carbon, sea salt, and others, as well as SO2, CO, and ozone. And while we're on this slide, I just wanted to briefly mention a couple of limitations with these data sets for awareness. So both of these data sets do not capture variation in air quality at local scales or areas where there's large elevation differences. And they should also not be used to assess NAAQS or National Ambient Air Quality Standards compliance. To allow for greater geographic coverage of areas that we often lack data for, we'll be working on expanding both of these data sets to include Alaska, Hawaii, Puerto Rico, and the US Virgin Islands. So this means that we will have forecast as well as daily air quality data at county and census tract levels for these areas. Next, please. Tracking and NASA previously worked together to create county and census tract level measures using NASA's MODIS product, as Helen mentioned, which includes measures on the Data Explorer for total area flooded and total population affected, both for recurring and unusual floods. Now we're looking at a synthetic aperture radar or SAR-based product from the Sentinel-1 satellite. The data will be from the observational products for end users from remote sensing or Opera suite, which will result in measures that are complementary to the MODIS measures, as Opera allows for seeing through clouds and at nighttime. Next, please. Finally, we're looking forward to continued collaboration between CDC's tracking program and NASA. We're planning on updating and improving upon measures that we currently have on the Data Explorer, as I mentioned on the last few slides. We also plan on continuing to build new data pipelines so that there's easier access to environmental data across CDC and for partners for surveillance, analysis, linking with health outcome data, and other uses. We also have a data set inventory that we plan on using in the future to explore data sources for additional environmental hazard data that are of interest to public health practitioners. Finally, we hope to see users, including all of you, taking advantage of these rich data sources to study the health impacts of environmental hazards. So we would love to hear from you on either how you see using these data, environmental data that you would like to see for your own analyses and work, and then also if you've used any of these data sets, how you're using them in your own work. So please do either let us know during the Q&A or make note of our contact information on the next slide and reach out to us. Next, please. And you can find our contact information here. So like I mentioned, please reach out to us with any questions, comments, or ideas for collaboration. Thanks again.
Thank you so much. Thank you to all our presenters today. Incredible work. Thank you so much for sharing. Next, and we're on the right slide. We do have time for a few questions. And I see there are quite a few questions in the Q&A box. And thank you to our presenters who have started answering questions. We usually do have too many questions to answer. So they've already gotten started answering a few of those questions. And I will read out a few questions and then also try to get some additional questions in at the time so that we can get some answers over audio. So let me go to some of the questions that have already come up. For instance, that have been answered. What were this is for Dr. Lombard, what were the associated co-infections? And Dr. Lombard answered this question by saying we're still evaluating co-infections and comorbidities. Let me try to stay on topic and let's see. I think another question that came up for Dr. Lombard was, do the non-clinical cows that tested positive have a lower CT value than clinical cattle? How do CT values vary over time from time in individual cattle after first detection? And so Dr. Lombard answered, when virus was detected in samples from non-clinical cows, it was generally in the 30s compared to lower CT values in samples from clinical cattle. CT values generally increase over time. Viral load decreases. I'm going to go to a few questions that were not answered that I'll ask Dr. Lombard to weigh in on. Did these dairies share workers?
Thanks for the question. We don't know. We don't. These two dairies that I presented today, there were no shared workers between those two dairies.
Thank you. And I'll move on to the next question before I think I'll switch over to our other presentation after this, but one more question for you, Dr. Lombard, before we switch. Were there any herd bulls affected or tested?
I'm not aware of any. I'm sure there were, but I'm not aware of any specifically. Sorry, couldn't help you on that one.
Okay, thank you so much. I'm going to switch over to the last presentation that we just completed. And I'm going to try to find one of the questions that were already asked so that we capture this for the recording for those of you who may be going back to look back on this. How did you develop the architecture of the database, and what coding system did you use for this purpose? And so Dr. Werner answered and said the Tracking Data Explorer was developed by CDC with the contracting company. It's a mix of custom and out-of-box components. Everything is built on top of Angular for the web framework. Then we use some components like open layers and AnyChart for mapping and charting. If you have any follow-up questions, you'll have to ask Dr. Werner. I'm just reading the answers aloud. But
That's as much as I know. I can direct more questions to our informatics team, though.
Okay.
Yeah, thank you.
Thank you for answering. Another question that came in for this presentation group is, do satellites also have to be approved by countries other than the US? Since they will be orbiting around their territories as well. And Dr. Scholar Ooze answered this question. I don't know if you want to answer out
Sure.
loud or if you want me to read it.
Yeah, I can chime in. So basically, no, they fly high enough that it's not an issue. It's above the airspace, the sovereign airspace. Also, the government satellites are very coarse. However, private sector, commercial companies have been launching Earth observing satellites more recently. That's becoming a huge industry. And they do them at 1 meter and even finer resolution. And those have led to some really interesting discoveries. Those were in the paper during the COVID times. You probably saw, cars in the parking lot or not in the parking lot, led to a lot of evidence about what was going on in China during the early days of COVID. And then I wanted to say something about a newer question that came in about using these observations for foodborne illness, because it's a very interesting question and it's an area of active research. The Earth observations have been used with other data in sophisticated modeling efforts to predict things like Vibrio. We're also trying to detect water quality factors like E. coli. But it's hard. It's very hard because these things aren't visible. And so our Earth observation data does best when there's a clear visible signal, and especially a large pattern. And so we're hoping that machine learning will provide new opportunities, but that's very much an area of active research.
Great, thank you. And staying on you for one more second, there was another interesting question that came in about, does soil moisture data help predict wildfires or landslides? And you answered that as well, but would you like to?
That's right. Yeah, we have groups that they model floods and landslides, and so that is soil moisture is important for that, as well as vegetation and other variables. So they incorporate all of those in their models. Wildfire, both the buildup of the wildfire fuel, and then the likelihood of the wildfire, and then the post-fire recovery as well. So yes.
Thank you. Okay, so we do have more questions, and I want to make sure we're spreading out the questions equally. So Dr. Lombard, there was someone who wanted to clarify something in your chart. So the chart Farm BC HPAI early detection in bulk BTM and pen samples. Are the pen samples environmental samples? And you
Yeah,
answered. Go ahead.
Go ahead.
Go ahead, Dr. Lombard.
I was just I should have clarified that is milk as well. So they collect milk samples that represent that pen. So a representative sample of milk from that pen of cattle. So it is not environmental. Those are milk samples specific for that lactating pen of cows.
Okay, thank you so much. All right, so I'm going through the questions, and got another question for you, Dr. Lombard, that you did already answer, but wanted to capture for the recording. Are the recovered cows being culled? Are they safe for human consumption? And Dr. Lombard, you answered and said, yes, they are. USDA would be better to answer the safety questions. So let me know if you want to say anything more about that, but you did provide the answer in the Q&A box.
Yeah, I think the data that has been presented so far says that they are no to very low risk.
Okay. Thank you very much. And again, this question has already been answered. Are cows also showing conjunctival changes? Has viral antigen been detected in cattle from this site? And so, Dr. Lombard, you mentioned that we have seen very few cases of conjunctivitis, but you all didn't sample them. There are many causes of conjunctivitis in cattle. So that was the answer to that question. And if our presenters don't have anything more they want to say on the topic, we will begin to wrap up. Thank you all so much for participating, asking questions, and tuning into this presentation. If you do have any more questions, we have included the presenter email addresses on this slide, and a video of today's webinar will be posted within 30 days. Next slide, please. And please join us. This is the last ZOHU call for this year, 2024. So please join us for the next ZOHU call on February 5th, 2025. And we thank you so much again for your participation. This will end today's webinar. Have a great new year, and we'll talk to you and see you guys again in February. Thank you.